So my pleasure to be here today. As Patricia mentioned, I did join the fellowship a bit late. So where I am at with my project is definitely in a bit of the catch-up space still, trying to get caught up to where a lot of others are. With that said, really open to any feedback and recommendations, suggestions, all of that good still. So my name, once more, is Natalia Ronceria Ceballos. I currently wear the hat of Executive Director for the Solutions Hub for Valley of the Sun United Way. That said, I do wear various other hats in community as a consultant. And when I started with United Way in January of 2019, very quickly discovered a project that had been actually taking shape in California for several years that was named the Real Cost Measure. And it really stuck with me, and I have wanted to try to bring that concept to our communities in Arizona, and finally found the right place to do so with this project. So my project is around what is the real cost measure for living in various communities in our state, in Arizona. And what you can expect in terms of the agenda today, I called it the flow. I don't know why, I just wanted to do something a little different. But I will dive into what we are seeing as the issue. Why would this even be needed in community? The main questions that we're entertaining right now, and what I believe is really has become the main research question, though of course open to suggestions and feedback still. What is the current hypothesis around this, and what are we taking in terms of initial steps for a research plan, and then what do we think as of now those next steps will be, and potential deliverables, and of course some acknowledgements as well. So what are we talking about here? The current federal poverty guideline, or I should say there's two ways to define this. Some people will say the federal poverty line, others you'll hear federal poverty guideline. They really are interchangeable terms. And so more or less are speaking about the same thing. There are other types of federal benefits, but for our case and for this project, just focusing on the FPL. So what is the FPL? It's used to determine eligibility for an array of federal assistance programs. These programs can consist of everything from Medicaid, food stamps, what's called CHIP, or Children's Health Insurance Program. This also helps identify who would be eligible for national school lunch programs. So very important information for where, who I should say, can gain access to federal assistance programs. Now, while this is updated in the sense of rate of inflation is taken into consideration on an annual basis and the rate is adjusted for that, the actual parameters that are used to identify the FPL have not been updated in quite some time. In fact, technically, depending on who you speak with, several agree that the actual parameters have not really been updated since even the 1970s. And I'll get into what those are in just a sec. So what we are discovering, or what we're seeing, is that the federal poverty guideline is still good for some things, but it's not really an accurate portrayal of who is really experiencing poverty in various communities. And frankly, we, in the space of social sector, especially health and human services work, we define populations as those who are experiencing poverty, and then there's also those that are the working poor. So this is really about trying to identify who really is working poor, who actually might actually be in poverty, but is being identified as working poor and not gaining access to potential programs and services that really would be a benefit to them. So the federal poverty guideline as of now is what you see in front of you. It is based off of households, and households are determined by different size, and you can see on your screen. So it could be a single adult with a child, it could be two adults, it could be family units, it varies, and they do have slightly different amounts for Alaska and Hawaii, because there is agreement that cost of living is slightly higher in those two places. What's been interesting, though, is even if you look at a state like California, one would assume cost of living, or even in a place like New York. But those are not taken into consideration as areas that might have higher cost of living compared to even, let's say, here in the state of Arizona. So why does this matter? Why should we care to find out what is that gap? You know, how many might actually really still need access to those types of programs, et cetera, that are not able to gain access right now due to the FPL definition? Well, we know that poverty impacts us in many different ways. And when I say us, I really do mean us as community, as a whole. This is not just about impacting individuals. This stresses systems. This puts stress in various ways on our health, etc. So as of, and really looking forward actually to the new census and seeing what is adjusted from it, but of course these are still numbers taken from the 2010 census for the most part. So more or less still, well, I guess I should backtrack and say this is pre-COVID. So we also know that, of course, these numbers are probably much different right now and are going to be drastically different in the near future, if not, you know, just in the future period. So I should say that this is pre-COVID. So you can see in front of you that, you know, more or less the national poverty rate is between 13.5 to 14.7%. That said, we know it actually is much higher when you take into account that basic needs these days have absolutely increased based off of like the parameters I mentioned that the FPL is still using. And so those parameters for the FPL, what they mainly consider, they do consider food costs, they consider shelter costs, some transportation costs, and some other necessities. They are very sort of broad in terms of what that might consider. But for example, like childcare costs are still not something that are included in the FPL, and that's a very huge cost for a lot of families. So we would assume that's something that should be taken into consideration. If we look down and drill down into our county, into Maricopa County, which is the largest county in the state of Arizona, as of 2016, we had just over 666,000 individuals who were considered at or below the poverty line, which is about 16.5% of our population. Of that, though, below 18, we see that uptick, right, about 23.7%. Now, if we were to include working poor numbers, meaning those that fall just outside that FPL range, these numbers, we assume, absolutely go up. We know they go up. And here, just to show you the difference between 97 and 2015, this is again from the census. You can see that Arizona always has been overall a bit higher than our national average when it comes to poverty. Maricopa County has fluctuated slightly, sometimes dipping a little below, but for the most part, especially since the recession hit in 2008, we've stayed above. Now, still, why does this matter? What is the impact? I mentioned this does not just impact individuals, but systems. It impacts our communities in various ways. So just to highlight one example from Central City, if we're looking at the Central City, and I know a lot of us live in the Central Phoenix pocket, more or less between I-17 to 16th Street, east from the I-10, et cetera, as you can see, 28% or nearly 30% of our kids under 5 are considered food insecure. This can mean children who might only get their meals when they're in school, or only are able to access 1 or 2 meals a day, maybe even just 1. And again, depending, usually it is in school. 28% under the age of 18 are also insecure. Our seniors, obviously we have majority, over 50% of households earning less than $25,000 annually. And a lot of these folks would actually be considered in the extreme poverty space, which means that you're making less than 50% of the FPL. But this also really has huge impact on health, right? Not only, and when I say taxing on systems, these are the type of systems that inevitably get taxed more and more. I really wanted to underscore that we have lots of data now. We have a lot of proof that poverty or not having access to basic needs really does correlate to a negative impact on an individual's health. Add that up, right, to a whole community, and now we have a lot of different types of ripple effects that you could go into. But we know that health is impacted by lower socioeconomic status. This can impact everything from heart disease, diabetes, hypertension, mental illness. Of course, undernutrition is a huge issue. And just imagine, again, the ripple effects of all of this. So what are we actually asking here then? Why do we care about this? What do we want to do about it? These are sort of the main questions that I originally had. And frankly, the top one is really where we are landing, in the sense of we really want to identify what is the gap in income. That is why it's called the real cost, right? What would a family or an individual, a household, actually need in Arizona to truly fill their basic needs? Other questions around that are, we have to consider, what are the costs? What are those basic needs? How do we define that? How are we defining households? Also, how could it benefit communities if more individuals were able to access these programs, again, if we were to adjust the FPL? I think here is also where we can explore, how are they getting by now? This could tie into identifying elements of resilience of these communities that already exist, and perhaps even leveraging those in some way. And again, I think for me, on the end of thinking about philanthropy and funders and state funding, how could this kind of information really help our various communities impact, right, how funding is allocated? Okay, 5 more minutes, got it. So primary research question that we have on the table right now is, what are all the considerations and factors to take into account to identify the gap in income between FPL and the real cost to fill basic needs of households in various communities across Arizona, and how can we best visualize this data for public use? My hypothesis right now, and I say right now because of course this can all be in flux, is that after we take all these different elements into account and consider basic needs for various households in the state, that we will see there is a gap between actual income needs and FPL definitions. And then knowing what this gap really is for our communities will allow state and philanthropic funders to make better decisions around funding, program development, services offered, and resources. So the California United Way Network actually is what, as I mentioned in the beginning, was the genesis of bringing this to Arizona. This is just a snapshot of their current website, and they produce these reports fairly regularly. The last one just coming out in 2019, but as you can see, there's ways that you can actually go in and plug in your information and look at a dashboard and see what the real cost is and the gap and all of that. Really, what is critical about this particular measure is that it incorporates a lot more elements, or many more elements, than just what the FPL does. So not only housing, food, transportation, it incorporates healthcare, childcare, other basic needs, though it does not include concerns like making major purchases or saving for college or even preparing for retirement or anything along those lines. This is what the dashboard looks like and potentially could look like for us using Tableau. And as you can see there, this is just one area, one county for the 2017 year. But there they were showing 30% of households actually were not meeting the real cost threshold of what be considered is needed to just meet basic needs. sorry, I'm going a bit fast because I know I'm getting so close to time. Right now, then, where we're at is trying to identify, like, what do we need to consider to really develop household budgets for the different areas in Arizona. Looking at county level, but then we're going to drill down even deeper to that. We really want to include mobile phone and internet access now as a basic need, especially we're seeing because of COVID and the future. We think that is absolutely now a basic need, and we're trying to figure out what else. Taxes as well, we want to take into consideration. Then we also are in the process of trying to define, right, what are the demographic data set requirements. We are looking to drill down using public use microdata so we can get hopefully as specific as possible for different communities. Right now, this is more or less where we're sort of looking in terms of finding available data on demographic indices. And I know I'm going quickly, but I'm going quickly. So our next steps, right? Step 3 is we have to compute what could be a real cost for counties and for the PMAs. And this can happen once we finalize indicators and our data sourcing strategies. And then we have to really reset and update the plan. We have to finalize what really can be deliverables based off of the timeline that we have. The reality of what would it take to build out a true public-facing dashboard, determine who else needs to be involved, who do we need to reach out to, what other data sets, and then of course much more, I assume. This is where we're at. We're still looking for some best source for data sets for childcare, taxes, internet, etc. And possible deliverables, thinking of course this could be a white paper, a publishable paper, outlining what is this gap and how does that impact, how even does the lack of access to certain resources impact households and said communities. Also, we could potentially get to the point where we can have the design of what that dashboard can look like in place by end of the year, hopefully. And the stretch goal is the actual dashboard. For me also, I really, really want to incorporate how could this help us create a more equitable landscape for our communities, period. And for dashboard use, this really would be literally, you could go in as a funder, you could go in as a policy person, you could even go in as an individual that's creating programming or services, maybe in the nonprofit sector, want to understand better what are the needs of the community you're trying to serve. You can even see for yourself, right, as an individual, what is the reality for my area? So that would be the intended audience and use. And I just want to say gracias so far to all of the Kurtz team, of course, to Patricia every day. I feel like, I think this is like a few weeks of just throwing this together. Dr. Sarveswar Prahara has been an incredible support. He's in India. We have a 12-hour time gap. So I just want to express thank you because it's been really interesting to try and wrangle, you know, touch bases and all of that, but we've been making it work with all this tech that we have. Of course, my team at United Way, the California United Ways, and of course, many more to come since we're just kicking this off. So I know I went over time, I'm sorry, but more or less, that's where things are at, and that's the thought of like, can I at least start getting what's needed to build this kind of dashboard for use for our communities, and can we really see what do people really need just to basically survive these days? Questions?
Thank you so much, Natalia, for your vision here. I really think it's great. We do have one question here from Michael who's asking, what do you think are your priority users, or who do you think are your priority users for the dashboard?
So as mentioned, I think that it can be an array, but since I am coming to the table with the United Way lens, thinking that would really try to focus on getting other entities like, well, like Arizona Community Foundation, for example, could potentially, you know, they're a huge funder here. Why not, right? Have them use a tool like this to help know where should additional funding be directed, what types of grants to put out and support, so on and so forth. So I think initially, probably organizations that are considered philanthropic funders in the space, but then second tier, I really would hope that the politicos of the world would use this, right? How could this influence policy that we have going on in the state and conversations at those tables? So, you know, students, individuals, all of that would be the like, yes, please use it. But my hope would be that it really would impact policy and also funding decisions.
Okay, very great.
You did attend a webinar that teaches them about dashboard. Really enjoy learning about this. Thank you, Michael. Well, I certainly would hope so. I would say I think so, yes, because especially, well, this has always been an issue and a topic of concern for our communities, but even more so now, right? With COVID impact, with the level of unemployment, with all of the ripple effects that we're trying to prepare to mitigate or at least respond to down the road in the months to come. I mean, I think something like this, people would like rush to try and get an accurate sense of, you know, where are the real needs and what gaps do we really need to fill at a local level, right? Because we know influencing at the federal level takes a lot more time and effort.
Yeah.
Thank you so much, you guys. Thank you. I appreciate it. And any suggestions
Great.
or recommendations on where to go or what to consider or all of that, please, I'm totally open.